With nearly 2 million residents, the greater Kansas City region has the same land area as the entire state of Connecticut. That's a lot of miles for any service provider to cover, including a single health system. I'd like to welcome you to Cerner Corporation's Spotlight on Health Midwest, a 14-hospital healthcare system with roots dating back over a century, serving the needs of the greater Kansas City area. We'll take a look at how key decision makers at Health Midwest enlisted a targeted strategy and integrated technology to establish a system-wide standard of quality in processes, productivity, and patient care. A large and diverse community relies on Health Midwest to provide its daily health care. Kansas City is a unique blend of urban and rural locales, ideas, and cultures. In much the same way, Health Midwest has evolved over the years into a diverse mix of 14 healthcare facilities. Health Midwest has over 75,000 admissions each year and nearly 700,000 outpatient visits, over 12,000 employees, 2,500 physicians. In the past, Health Midwest let each hospital and the departments within purchase the disparate systems of their choice. This random mix of technology was not only expensive to support, it created islands of information that couldn't be bridged. How was Health Midwest leadership to make effective business decisions without accurate data? Most importantly, how were they to provide the best care to the community? COO Jim Strebe explains how keeping consumers at the heart helped Health Midwest establish a successful strategy for standardization.
When we look at all of the input that we've received from our patients, the key thing we learn through that is that they need a system that is seamless to work through. One that they can really focus on their major task, and that's getting well, and not focus on all of our business complexities. Early in our process of integration and standardization, we knew that we had to have a common information technology platform across our system to accomplish that process. The only organization that we found that shared that vision for our system and for the community was the Cerner Corporation.
Health Midwest set out to eliminate variance across the health system, but which department would take the first step? As one of the highest volume and most critical departments, Health Midwest's laboratory services seemed an ideal starting point.
We felt early on our key to success was integrating, and by that we mean getting the lab's key product, clinical information, better insinuated throughout the clinical processes to make other departments better, to make the processes of patient care smoother and more rapid. So very early on we tried to look beyond the lab and not see ourselves as an entity, but to really look for walls, whether it was between lab and nursing or lab and pharmacy or lab and cardiology, and look for opportunities to kick those walls down and integrate our activities better with our colleagues.
And knock down walls they did, not just between departments, but between entire facilities. The laboratory's success served as the template for the Health Midwest service line strategy. Through the establishment of service lines, physicians and clinicians take an ownership role in the standardization process, working closely with individual hospital management. This unique organizational approach gave structure to standardization and paved the way to integration across the health system.
Our goal for every patient is to deliver a seamless, integrated system of pertinent clinical information relevant to their care, and probably the best method or avenue that we have in order to attain this is through a single digitalized, centralized patient record. And thus it provides us the opportunity to avoid redundant information, redundant data collection, but it gives us the most important thing, which is to provide and help to manage that person-centered information, no matter where they are within our system or what affiliate they are currently receiving services from.
Just as in the laboratory, the radiology service line faced a high volume of work and mostly paper-based processes. Cerner RadNet technology enhanced radiology workflow by speeding up results reporting and opening new electronic lines to access those results. And that's only the beginning.
One of the future things that we were really excited about is voice recognition. This will allow the radiologist to dictate, and as he dictates, that report will be printing off next to him so that he is able to look at it, correct it at that moment, and send it on to the referring physician and to the nursing units. Another big factor for us is for the technologists. As we get more and more automated into PACS and with our RIS systems, they will become much more productive and will be able to feel that they are doing a much better job taking care of the patient because they are no longer buried in paperwork.
Health Midwest is already on its way to growing standardization in other service lines throughout the system, such as pharmacy, rehabilitation services, and medical records. They're also looking at how to approach the cascade of industry issues like patient safety and e-health.
We will be able to assess where we have patient risk within the system and how we can best mitigate that risk, whether it's taking a look at your policies and procedures or the systems that you have in place, or whether it includes more of your smart abilities, which would be your decision support, your alerts, your messages, warnings that would prompt the end user to maybe think twice or research further, go back to the physician for clarification, those type of things.
The road to standardization has been a learning process for Health Midwest. They say practice makes perfect, and while no conversion is perfect, each rollout experience has helped make the next one roll more smoothly.
And the learning that we gained or experienced in that time period has now allowed us to significantly decrease the hours or the time spent to take any one of those applications from the initial facility where we have implemented it onto any one of the other sites at Health Midwest. The first site was at Menorah Medical Center. The second site took us less than half the time to implement. The third and fourth sites were even quicker than that, and right now we have a plan in place where we can take RadNet to another facility or bring up another facility to support with RadNet, and we can do that in between 3 and 4 months, fairly consistently now.
The effects of integrated information technology are felt at every level of the health system. For CEOs like Steve Wilkinson, it's daily enterprise-wide knowledge that helps him make the most appropriate decisions in caring for the hospital.
And then just generally for decision-making, not only for me as the CEO, but also other members of our senior management team, having the ability to determine what reports would be important to us and having access to those in a rapid sequence has allowed us to, in a way, look at the data, make decisions, and reevaluate on a continuing basis much more efficiently than we were able to do in the past.
Webster's defines a system as a group of elements that interact and function together as a whole. Health Midwest brings that definition to life with the help of integrated technology to make consistent, quality care a standard throughout its health system.
Part of the value of the Millennium system is it has a vision of providing accurate information integration not only for the physicians and our patients and our facilities, but it also has the ability to tie our community to that integrated model. And I think that well positions us for the future.
Driving out costly variants, raising the bar on clinician productivity, delivering quality care for the people of Kansas City. Health Midwest is proving that no obstacle is too large when the vision of transforming healthcare is shared.